Health officials are racing to contain a rapidly expanding outbreak of a rare strain of Ebola in Central Africa. The World Health Organization declared an international public health emergency over the weekend. So far, at least 116 suspected deaths and more than 300 other cases have been reported in the Democratic Republic of Congo and neighboring Uganda. Today, the CDC confirmed at least one American has contracted the disease, a medical missionary who had been working in a hospital in the DRC. That country's health minister pleaded with residents to visit new government treatment centers if they had symptoms.
This is not a mystical disease. Make yourself known. Make yourself known so that you can be taken care of and so that we can prevent the disease from spreading.
For more, we're joined now by Dr. Craig Spencer. He's an associate professor of public health and emergency medicine at Brown University. He also contracted Ebola himself while working as a physician in West Africa during a 2014 outbreak. Dr. Spencer, welcome back to the News Hour. Thanks for joining us.
Thank you for having me on to talk about this.
So on top of all this other news today, the U.S. announced an entry ban for non-citizens who've been in the DRC, Uganda, or South Sudan in the last 3 weeks. Let me just ask you, what concerns you most about this outbreak, given what we know right now?
What concerns me most is that we learned way too much, way too quickly for this to be anything but really bad. I am concerned about the next few weeks and the next few months. We have found ourselves weeks, maybe months behind when this first started spreading. Over the last year, we've lost a lot of the response capacity, particularly here in the U.S. And I'm also concerned about the fact that this is in a really tough region, not just because of this outbreak, not just because it's at a border, but because this is a place with a lot of conflict, with mobile populations. This would be a hard outbreak to manage an ideal situation. This is absolutely not the ideal situation.
Okay, let's take some of those piece by piece here, because the timeline of this, it's now believed the very first suspected case was about 3 weeks ago, a man who died in late April in DRC. What is it about this strain or about the circumstances that took so long for us to know what was going on?
Well, I will posit that the first case was likely well before that. I say that because you don't go from one case a few weeks ago to hundreds and hundreds of cases this quickly. So I think this has been spreading a lot longer. And as we get genomic analysis, we're going to be able to get a better idea of how long this has been going on. But your question stands, why did it take so long for us to recognize this? I think part of it is that this health zone, the health zones that are impacted, have limited health infrastructure. They are plagued by a lot of conflict and instability. It's a place that I've worked a lot in the last 15 years. It's a place that is really difficult to provide health care, to get around. And I also think that there were delays at the testing level, particularly because this Bundibugyo strain is different than the majority of outbreaks in the past that have been caused by either the Zaire strain or the Sudan strain, which are much more common causes of Ebola outbreaks.
Tell us more about what we know about this strain, the Bundibugyo strain, as you mentioned. Do we know enough to know how the response should be different?
For all intents and purposes, primarily from the healthcare side, this is exactly like, and the management is very much the same as any other type of Ebola. There's only been 2 other Bundibugyo outbreaks. This is already the largest. And in fact, this is one of the larger Ebola outbreaks in history after the 2014 outbreak and a 2018 outbreak in the same area in DR Congo where there's currently an outbreak. What's different about this strain is that unlike the Zaire strain that caused the 2014 outbreak that I was infected with, we don't have FDA-approved treatments for Bundibugyo. We do for Zaire. We have vaccines. We have treatments that can help drive down the death rate. But for this strain, we have no investigational, no approved vaccines, no approved treatments, which means that responding to and controlling this outbreak is going to require good epidemiology, good contact tracing, and good bread and butter public health, which again is going to be really difficult in a place that is plagued by conflict, that has a lack of good health infrastructure and providers, and is quite suspicious of outsiders.
I just want to give folks a sense of what it's like for people on the ground who are experiencing this, the sense of fear, because people in the DRC and the neighboring area are really frightened right now. This is a man named Frank Amani, who's from the eastern city of Goma, sharing what it's like.
I'm very scared because we have heard about Ebola in previous years, and now we're hearing that Ebola is in Goma. I'm calling on the local authorities to intervene because we're also scared because of the war, and now because of Ebola. We're really scared.
Dr. Spencer, you have worked on the ground in DRC, in this region in particular. Do they have what they need to respond to this?
Absolutely not. No, I don't think anyone in Congo would tell you that they do either. Look, this was a region that was already a really tough spot to work before last year when the U.S. cut a lot of its support to USAID and other NGO partners that were working in the region, not only for healthcare, but for a whole host of other humanitarian support. I've been told that there's not sufficient personal protective equipment. I know from working in many of these clinics that there's not the basics like gloves or in some places even running water, which can be helpful in preventing transmission. And as you mentioned, this is a place that has been plagued by a lot of instability for decades. We've already seen how that has contributed here to a lot of movement around the region. We also know that there are cases in Goma, which is a very large city. It's also a big connection point to other places throughout Congo. And we've seen cases unrelated to each other in Kampala, the most populous city in Uganda, hundreds of kilometers away, all of which makes me realize, one, this is going to get a lot worse before it gets better, and two, we still don't have a full handle on what exactly we're grappling with yet.
In the 30 seconds or so we have left, what do you want to see the U.S., other international actors doing right now?
We need to surge, not just because we're worried that there'll be more Americans infected or that they'll get on a plane, but because this outbreak is already big. Over the last year, anti-American sentiment has surged because of the way that we pulled out our support overnight. We need to fully engage our CDC. We need to get back on the ground, make sure that U.S. support, financial, logistical, and medical support can help end this outbreak before it gets worse. Otherwise, it's going to be a problem not just for the region, but for the rest of the world.
Dr. Craig Spencer at Brown University, thank you so much for your time.
Thank you.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.